Hello guys, welcome back to the channel, and it's unit 11, that is Pharmaco-Therapeutics in obstetrics. In the delivery section, what are the drugs should be given for the pregnant woman, what are the drugs should be given, and what are the drugs should not be given to the pregnant women, you'll see from this chapter. And from this chapter you'll get one question for 2 marks. So if you read this chapter you'll be perfect with 2 marks. Drugs used in indication of labor. What are the drugs that is used in the time of labor to start the labor? What are the drugs used to start the labor? Oxytocin and prostaglandin are the drugs used. Oxytocin used to improve the contraction. When the uterus starts to contract and relax, then automatically delivery gets started. This oxytocin is not just used during the time of labor, even after the delivery of the baby, to reduce the postpartum bleeding. We will use oxytocin, not just in this condition, even some other complications like subinvolution of uterus. In this condition we will provide oxytocin, and this oxytocin belongs to a group known as oxytocic hormones. Next, what are the indications? At what conditions this oxytocin will be provided to the patient? If the Bush-up score is more than, like, high Bush-up score, for example normal Bush-up score is 6 to 13. If the Bush-up score is around 9, 10, 11, 12 or more than 9, we will provide oxytocin to make the delivery easier. If the Bush-up score is less than 6, that is from 0 to 5, we will not give oxytocin, we will go with other mode of delivery. To prevent the PPH, that is the bleeding after the delivery, in prolonged delivery conditions, we will provide oxytocin. What is prolonged delivery is the cervix dilation should be opening at least 1 centimeter in 1 hour, and the descent, that is the movement of baby towards the birth canal, descent should be at least 1 centimeter or more than 1 centimeter in 1 hour. If this is not happening, then that is prolonged pregnancy. In preterm deliveries, baby will be not fully grown, so baby can't pass on its own, so we will provide oxytocin. And if mother has any condition or placental conditions, we will provide oxytocin. If there is multigravida, that is more than one baby, we will provide oxytocin. Dosage of oxytocic titration method is one of the common method which is used while administrating oxytocin. First, we will give 5 drops to the patient per minute. 5 drops will be falling. And then after half an hour, like each half an hour period, we will keep on adding 5 drops more. Like now you gave 5 drops per minute. In next half an hour, you will add 5 drops more. At half an hour, you will be providing 10 drops per minute. And in next half an hour, you will add another 5 drops. And at that time, you will be providing 15 drops per minute. You will be keep on adding it until the woman gets pain, that is for in 10 minutes the mother should get 3 or 4 times the contraction, 3 or 4 times she should get the pain, and each pain should be at least 40 seconds. At that time we will stop the administration of the oxytocin. And generally in the mothers, in 20 drops per minute the woman gets contraction, in the sense in 2 hours the woman gets pain. Oxytocic treatments has few branches like methargine, pitocin, and ergotrate. These are the types of oxytocin. And what are the complications of using this oxytocin? If you are using it very much, due to excessive contraction, there will be excessive injury inside the uterus. Because of this, in the postpartum period, because of injury, lots of bleeding might occur. Not just bleeding, even at the time of delivery, if there is excessive contraction, it may lead to the death of fetus also. Even mother might also get death. And mother's heart rate will be irregular, and the cranial system will be disturbed, like a headache, blur vision, and the nerves which is present in the neck and the ears will get a pulling effect, and confusion will be seen. Mother will feel very weak and she will be very dehydrated. These are the complications of oxytocin. What are the precautionary measures that should be followed before administering the oxytocin? See, generally maximum 30 drops per minute will be provided. So make sure you are not providing more than that. Generally 20 drops is enough for a woman to get contraction. And then increasing per time, we need to check the status of the mother and the fetus. Like in half an hour you are going to increase the dose, right? At that time you need to check how the mother is feeling, how the contraction it is, how the pain it is, at what interval the mother gets the pain. By seeing that, you should increase the dose. And as mentioned, per 30 minutes you should change the dose, you should increase the dose, you should not cross the time. As per the doctor's advice, you should increase the dose, you should not cross the dose level. Like, you should not increase the dose level, neither you should actually decrease the dose level. You should follow the line of the dosage. And before administrating, make sure you check the risk factor of the mother and the contraindication conditions. Before administration, you should see that. These are the precautionary measures. Prostaglandin is actually available in the gel form as well as in the tablet form. We have three options for it: misoprostol, dinoprostone, dinoprost. This three function mainly is to induce the labor by rupturing the cervix. Now, how the dosage is provided? Transvaginal, that is in the form of gel ointment. 25 microgram will be provided for 3 hours and 4 times it should be provided. Then automatically the normal delivery will start to begin. If it is oral, then 50 microgram will be provided for 4 hours. For every 4 hours it will be given, then automatically the normal delivery will occur. When it comes to dinoprostone, here we have a dosage, it is an gel form, and here 0.5 mg. It will be applied in the cervix region in every 6 hours. For 3 to 4 times after applying it, the normal induction of labor occurs. Analgesic drugs, these are the drugs which helps us to get relief from the pain. When the injection is injected, at that region we will feel numb, we can't feel, there is no sensation, we can't move the muscles, and generally it's a temporary measure, not a permanent thing. After 1 or 2 hours we will get automatically to the normal condition. While see, for each region we have a regional anesthesia, that is it will differ from one region to other region. And for delivery purpose we will use the pain anesthesia, which actually blocks the pain below the vest, mainly on the reproductive system part. And we have few types, that is epidural block, spinal block, and combination of spinal and epidural block, pudendal block. These are the types of anesthesia drugs that is used in the delivery process. First we have epidural blockers. This is a blocker in which the numbing medication will be inserted in the mother's body in the backbone. Through the backbone, this medication will be inserted, and after inserting in the lower body below the vest, the mother feels nothing. The pain relief will be seen. And in this medication, we have another condition known as walking epidural. In walking epidural condition, even after inserting the medicine into the mother's body, the mother's leg have some kind of still energy that mother is able to walk. There is pain relief and still she can walk after administrating this anesthesia. That is walking epidural. And next we have a spinal blocker. It is also administered in the spinal cord, but it is administered below the epidural, that is in the base of the spinal cord. After administrating, this blocks below the chest. From below the chest you can feel nothing, and it lasts for 2 hours. The benefit of spinal blocker is it can be administered easily and it works better than epidural. Next we have combined epidural spinal blocker. In this, in one injection we will give two medications. In epidural injection we will be inserted. First we will give epidural injection, and then by following in the same needle we will give spinal blocker also. In this condition we have side effects generally seen because we are uploading two injections, so there might be a side effect because of combination of this both. It is generally given to the mother, one whose body is not working for one blockers. Next, pudendal blocker. Pudendal blocker is not actually inserted through spinal cord, it is given in the regional part. Like it works like a local anesthesia. It is given in the vaginal wall or in the perineal wall. After uploading this medication in the body, it works for almost 1 hour, but not more than 1 hour. That is the main disadvantage of this condition. It provides pain relief condition, but still it's not very long lasting. Apart from those blockers, in analgesic drug we do have two other techniques from which you can get relief of the pain, and it has been asked in the previous year questions also. Like first is TENS, that is transcutaneous electrical nerve stimulation, and here you can get relief of pain without having any medication during the labor, and it is performed by placing two electrodes by attaching to your skin. It will be not performed while lying down. the mother will be setting, because during the pregnancy the woman can't sleep backwards this way. Two electrodes will be attached, and it will be attached to your skin, and due to the electric impulse the pain will get relieved. This is TENS. We have PCA, which is patient controlled analgesic. In this condition, the medication dosage level, everything will be already inserted into a machine. It is according to the prescription of the doctor. This method is followed to avoid the overdose and to avoid the risk side effects and all. Already the medication will be present inside, and the dosage level, everything will be set, and then in the form of a tube it will be inserted into the region. This is patient controlled analgesic. Tocolytic drug, these are the drugs which is used to stop the uterine contraction. It is done in many conditions, like in the premature labor, in the preterm labor, to stop those labors. When the mother gets pain, to stop those pains, we will administrate tocolytic drug. Apart from this, if the delivery process is going on and we get to know the mother has high risk condition, that the delivery process, the vaginal delivery process can actually lead to any kind of injury or fetal death, then we will stop the uterine contraction and then we will go with C-section. At that time also this tocolytic drug will be provided. So generally it is provided during the preterm labor and other high risk condition time. Now, what are the contraindication, or to which conditions we will not administrate this tocolytic drug? When there is a antepartum hemorrhage before the birth of the baby, when there is bleeding is seen, at that time we don't give this. And for cardiovascular disorder patients, when a patient has thyroidism, and if the patient has uncontrolled diabetes mellitus and even uncontrolled hypertension, at this condition we will not give tocolytic drug. Dosage of tocolytic drug. In tocolytic drug we have several drugs, and each drug will be differing from one or the other. The drug dosage will be differing, but this is the borderline. Comparing to this, those drugs will be either little bit more or little bit less. First we have subcutaneous. In subcutaneous, if you see, the dosage will be 0.25 mg, which will be given in the subcutaneous way, and for every 1 to 4 hours it should be administered. See, in tocolytic drug, many drugs will be administered in the subcutaneous way. So one drug will be like 2 hours gap. In 2 hours it should be administered, while other drug will be like 3 hours gap. That is what he has said. In every 1 to 4 hours it will be administered. Maximum 5 mg should be administered in a day. In IV we follow titration method. First we will administrate 10 mcg per minute, and then after every 10 minutes we will keep on increasing 5 mcg. Once we get to know the patient is okay, the patient is getting comfortable, at that time we will start to decrease 5 mcg for every half an hour. Maximum we should give 25 mcg per minute. Next we have oral doses also. In oral, 2.5 to 7.5 mg will be provided. It will be provided either from anywhere, like from 1 hour to 4 hours, anywhere it will be provided. Like one oral drug will be like for 2 hours it should be given to the patient, and other oral drug will be like for 4 hours it should be given to the patient. These are the dosage of tocolytic drug. In tocolytic drug we do have calcium channel blockers, in that nifedipine, and then prostaglandin synthesis inhibitor, in that endomethacin and ketorolac, sulindac, and then we have magnesium sulfate. See, don't get confused with this word. Prostaglandin is used to induce the labor. It is used to produce contraction. We are using here prostaglandin synthesis inhibitor. We are using a drug which is stops the prostaglandin work. That is, we are using to stop the contraction. So first, calcium channel blocker, nifedipine. Here the side effects are seen in mother are redness in the skin, headache, dizziness, dehydration, mainly low BP. While this calcium channel blocker, there is no side effect seen in the baby until now. And then prostaglandin side effects in the mother is possibly heart burning and then sweating, lots of sweating. But in child, it will cause increase in blood pressure and decrease in blood pressure. That is, sometimes blood will be flowing very high speed and sometimes the blood will be flowing very low speed. So when the blood is flowing in high speed, at that time there will be a problem in heart, lungs and kidney. While when the blood is flowing in a very slow speed, at that time there will be a problem related to bowel system, that is infection in the bowel. And then magnesium sulfate, here the side effect of the mother are redness in the skin, tiredness, dizziness, drowsiness and headache, weak muscles and cranial system problems like double visions. These are seen in the mother. In baby, if you see, there is side effects too, like tiredness, drowsiness, decreased muscle tone, in the sense the baby will be not be strong, slow breathing, loss of minerals. These are seen as a side effects when you use magnesium sulfate in a high rate. Antihypertensive drug, this is the drug which works to reduce the blood pressure in the patient. We have laetolol and propanol. These two drugs belongs to a category known as beta blockers, and they reduce the BP by reducing the blood flow in the arterioles and veins. Next we have prazosin. Prazosin is a drug which helps to reduce the blood pressure by reducing the blood flow in the veins. Next we have hydralazine. This group of medication helps in reducing the blood pressure mainly in the preeclamptic and eclampsia patients, and it is also known as a hypertensive crisis drug. At the time of emergency we will administrate this medicine and it will immediately reduces the blood pressure. And these four drugs, that is laetolol, propanol, prazosin, hydralazine, this four can be given to a pregnant woman. But captopril, this is not given to a pregnant woman. It will affect the growth of baby and even lead to death of the baby. Captopril, this is not given to a pregnant woman. It is a teratogenic drug and it helps to reduce the blood pressure. It belongs to a ACE inhibitors. These are antihypertensive drugs. Eclampsia and preeclampsia. Magnesium sulfate is the medication provided for this condition and it works effectively on this thing. This medication is given to a person who has eclampsia, recurrent seizures, and a person who has preeclampsia, and there is a chance that it might get developed into eclampsia. For these patients, we will provide this magnesium sulfate, and after administering this medication, the patient should be under observation because the side effects of this medication is seen widely. For many patients, the side effect is seen mainly because of the overdosage. The side effects are nausea, vomiting, weakness, dehydration, confusion, blur vision, difficulty in speaking. These are the side effects. And at the time of administration, at the time of observation, we need to monitor the vital signs, blood pressure, pulse, respiratory rate, the urine output. This medication is available in the solution form. Generally, it is administered 500 mg by ml. We have 2 ml ampoule and 10 ml ampoule. See what are the uses. Recurring seizures will be prevented, eclampsia will be prevented, and pre-eclamptic condition will be prevented. So, what is precautionary measure? What is precautionary measure? We will keep the person under the observation. Why? To avoid these things. Hepatic impairment and renal failure is the commonly seen disorder because of this medication. Next, teratogenic drugs. These are the drugs which is contraindicated to a pregnant woman. She is not allowed to take these drugs. If she take these drugs, it will cause a functional or structural formation disorder in the child. It may even kill the child. So generally in first 3 months, it is not at all advised a woman to consume this drug. If she consume, then there is a 90% chance the baby might have any kind of defect. In this we have first antifungal drugs. In that, Griseofol V, this is a drug which is used to solve the problems regarding fungal infections mainly in skin, nails and hairs, but this is not given to a pregnant woman since it is a teratogenic drug. And next we have ketoconazole. This is used to solve a problems regarding GI mycosis and vaginal candidas and any infections because of fungus seen in skin and fingernails, but still it is also not given to a pregnant woman since it is a teratogenic drug. And next we have trebinfine, which is a oral drug, and this is also not given to a pregnant woman. These are antifungal drugs which is contraindicated to a pregnant woman. Next we have antipsychotic drug. This drug is used to treat manic depression psychosis condition, but still it is not given during the pregnancy because it may form fetal abnormalities. And then anticoagulation drugs, and in this warfarin, which works as a vitamin K antagonist, that is it helps in clotting the blood. And during the pregnancy, if you administrate, it may even kill the baby, or there will be any congenital malformations or physical disabilities. It will lead a problem to baby, so it is not administrated during the pregnancy time. And we have antibiotic drugs. In this, tetracycline is not administrated during the pregnancy time because it will cross the placenta and it will affect the absorption of calcium. That is, it forms defect in the teeth and bones of the babies. These are the teratogenic drugs. Nurse's role in drug administration. First, you need to arrange the drugs in order. That is, before arranging, you need to see the expiry date and the name label. You need to secrete them in the order wise. That is the first thing. And after arranging, you need to secure them, because in some conditions after the labor, the mother gets into depression and she may attempt suicide. So she may consume random drugs, and even in severe pain, she may prescribe herself her own drugs, and she may try to consume any drug that is available in her hand. So we need to secure the drugs, we need to keep them separately, and we need to lock the cupboard in which the medications are arranged. And what are the medications that should not be given to any patients? Like, if you're not aware of what kind of medicine it is, you should not give that medicine in random thought to the patient. You should be well aware of the medication, and then you should need it to the patient. So when you are not aware of any medicine, you don't give it to it. And if the medicine is opened and the medicine has been changed its color, then don't give it to the patients. And before giving any kind of bottle tonics or any kind of solutions, you need to shake it well, because those solutions will, the sediments which is present in it will get deposited in the bottom. So if you shake it well, everything will be mixed, and then you can provide it to the patient. On providing medications, you need to follow these 5 R's. Those are right medications, right dose, right patient, right time, and right route. These are the 5 R's. And then this thing is very important. If the doctor has said to provide you medication to a patient at 9 o'clock and you have been forgotten, but it's okay, you can provide the medication within 9:30. That is, within half an hour of the time you can provide the medication to the patient. Don't delay more than that. And if the patient is going to undergo the operation, the patient is in the pre-operative stage, at that time you need to give the medication on time. You can't delay it. There will be hourly medication, or 2 hours, 3 hours period gap medications. You need to provide it on time. And if you see any kind of side effects or any kind of symptoms in the patients, you need to inform the doctor, and doctor will change the medication or change the route of the medications, like subcutaneous and IM. And lastly, as a special precautionary measures, that is, before providing any kind of medications to the patient, do double check it. Once you check, and you can ask your senior to check it also. Do check it well and then give it to the patients. These are the nurse's role in the administration of the medication. These are just the samples. You can't expect this 2 marks in the exams, because 2 marks are unpredictable. Do practice it. Meet you in the next video. Until then, stay tuned. Bye.